Today we will discuss regarding endocarditis, which is a similar type of infectious disease like yesterday we discussed, right, about pericarditis and myocarditis. Same like that, it is caused by most of the bacteria and viruses, that is infectious disease of heart. Okay. As per definition, endocarditis is an inflammation of inner layer of heart, okay, which is covered by inner lining of heart chambers, valves, and even similar nerve valves and aorta, part of aorta. Okay, the heart chamber, the inner layer of heart chamber, so 4 heart chambers, atrium, ventricles. So all those things will come under this sort of infection. Okay, so it only affects epithelial endothelial layer. Okay, endothelial layer of heart. Okay, not muscle or any other part. Okay, it is usually caused by certain bacteria, viruses, etc. So it involves heart valves also. Okay, types. So usually we have 2 types: infective endocarditis and non-infective endocarditis. Infective endocarditis you will caused by this bacteria and viruses. Non-infective endocarditis is caused by some sort of inflammatory conditions or drugs, etc. Over drug abuse or some sort of procedures, medical procedures. So because of such things also, they may develop non-inflammatory endocarditis. Okay, sorry, non-infective endocarditis. So as per infection is concerned, infective endocarditis, previously known as bacterial endocarditis. Okay, so it's usually caused by because it also caused by some sort of viruses. We will call it as infective endocarditis rather than calling it as bacterial. So infective endocarditis involves heart chambers and heart valves, most commonly found in people who have some sort of underlying disease conditions. We will further classify it into subacute bacterial endocarditis and acute bacterial endocarditis. SBE, subacute bacterial endocarditis, usually develops insidiously, okay, and progresses slowly. Okay, insidiously the onset ಆಗುತ್ತೆ ಅಂದ್ರೆ immediate onset ಆಗುತ್ತೆ and slowly progress ಆಗುತ್ತೆ. As the infection increases, slowly it will progress over the weeks. It may take over the weeks or months to completely show the peak level of symptoms. Okay, typically affects those with pre-existing valvular damages. Okay, so already if anybody is having weak immune system or damage in the heart chambers or valves, so for them it is more easy. They are more susceptible for such infections. So because infections will lodge in wherever there is a wound or infection. So imagine some sort of they are having some sort of benign wounds or ulcers in such areas, so or such epithelium, endothelium. So among such areas, the infection will get lodged and it will grow into dramatic stage. Okay. Acute bacterial endocarditis usually develops abruptly and progresses rapidly. A source of infection or potential entry often is evident. Okay, usually new infections in newer tissue is causing this type of acute bacterial endocarditis. Okay. So causes, it can be affected by both gram-positive and gram-negative bacteria and even from fungi. Most often it is caused by Streptococcus aureus. Okay, a pathogenic pus-forming organism, Streptococcus aureus, and in the Streptococcus itself, one more type of organism will come, which is beta hemolytic streptococci. Okay, which usually on hemolysis produces greenish colonies. Okay, so such type of bacterial infections that is called Streptococcus viridans. Okay, so by those bacteria and fungi and some sort of Candida albicans and viruses like Coxsackie B virus. Okay, Coxsackie B virus. So by such virus also it can get involved. Other predisposing conditions like cardiac conditions, prosthetic valves, congenital heart diseases, pacemakers, or any sort of surgeries involved. Okay, so some sort of even coronary intervention, some sort of dyes can cause allergies and later cause inflammation. Okay, so that comes under non-cardiac conditions like IV drug abuse, intravascular devices, procedures like some sort of dental procedures, tonsillectomy or surgical interventions in other parts of the body. So with such surgical interventions, so they won't be giving high level of preventive antibiotics or things. So immediately they may need surgical interventions or some sort of injury with damage. People with some sort of infections will come to doctors and they will go for surgical interventions immediately without any antibiotics. So in such conditions also, they may be at risk of getting this type of endocardial infections through this. Usually it spreads through this circulation itself. Okay, blood circulation. So here they are explained pathophysiology, that is usually because of any bacteria or viral infections. So there will be lodgement and growth and multiplication of bacteria. So whenever there is a growth of bacteria in interior chambers, so usually especially in heart, it will not allow excessive proliferation. What it causes, it will try to heal there itself. Okay, so when it tries to heal there itself, the things will not either grow extensively or not diminish or not vanish. So it causes scarring and fibrous formation of fibrosis, hardening of some localized tissue because of recurrent infection and recurrent growth of tissue and death of tissue. The fibrosis will happen. Okay, so those fibrosis will be accumulated with fibrin and thrombolytic agents or prothrombins or clotting factors. Okay, so that ultimately results in hardening of soft structures, okay, involved in the endocardium. So those soft structures may be papillary muscles of the ventricles, valves, bicuspid valves, tricuspid valves, or aortic and pulmonary valves. So these valves can also be affected or damaged. So ultimately, with those hardening of soft tissue, heart will stop proper functioning, and there may be regurgitation of blood. Blood will come back from valves. Valves will not close properly. So, and cardiac output may decrease. So, such issues will keep on generating. They are the complications of this endocarditis. Okay. So like that, finally it may go for compromisation or heart failure. Okay. So the condition can compromise to some extent with the lack of proper blood supply to various organs and decreased cardiac output. Finally, it may stop working itself. Okay, so that is the pathophysiology behind this disease condition. Okay, here is the sample of papillary muscles and flaps, okay, which are infected, and you can see the surrounding structure, which is having fibrous structure. Okay, so this is just an example. So each and every wound will not appear in the infectious site, will not appear as same as like this. There may be different conditions. Okay, so clinical manifestations, usually fever, that is especially low-grade fever is the most common in this type of disease conditions, along with chills, weakness, recurrent fever. So will be happening. Okay, so because of that recurrent fever, malaise, fatigue, okay, anorexia, clubbing, because of this reduced cardiac output and decreased oxygen levels, clubbing, and some peculiar symptoms like splinter hemorrhage and Osler's nodes will happen. A splinter hemorrhage means your nail bed. Okay, so in this nail bed there will be streaky dark appearance. Okay, so they are called as black longitudinal streaks in the nail bed are called splinter hemorrhages. Okay, then osculus node, a sort of dotted patches or petechial like skin bruising in the beneath the palm and various other parts of the body. It can also be seen. Then the Roth spot, hemorrhagic retinal lesions in the fundal examination. Okay, when they examine this eye, fundus of the eye at the retina side, they can find this type of hemorrhagic spot. Okay, so that's because of these bacterial toxins and bacterial actions. So at the various parts of the body, they will start infecting or damaging the tissue, and such sort of hemorrhages will keep on occurring. Okay. So here is a picture of hemorrhage or streak formation at the nail bed. Peculiar symptoms. Clubbing also happens. So clubbing is also there. You can see. Clubbing means nail bed will bend up to. It will not be flat like this. It will bend up to more than 180 degrees Celsius. Okay. So the angle will not be straight to our finger. So the nail will bend inside. Okay. So such types of symptoms will also appear. Then okay, here are the osculus node. You can see the picture of hands with bruising and bleeding spots. Okay, they will be painful, very painful, erythematous, they're reddish. Okay, and localized right in temperature. Everything we can see in such wounds. Okay, this is one more example. Okay, this is the retinal examination. Okay. So even we can call it as a microscopic view. So you can see the retinal blood supply with damage or bleeding at the Roth spots. Okay, so they are the bleedings. Roundish red spots are there now in this picture. They are the bleeding spots from retinal arteries and veins. Okay. Diagnosis usually by history collection, proper history collection, and previous history of any surgical interventions can reveal previous any surgical interventions through which these infections may transfer into blood or circulatory system. Okay. Dental, urological, or gynecological procedures in part 3 to 6 months should be evaluated for any sort of possibility of infection. Then history of any other diseases, valvular diseases, okay, coronary artery diseases should be ruled out. Physical examinations can reveal these heart sounds. Okay, you can write particularly whatever the heart sounds you are reading, ausculting or palpating. Those physical examinations you can write down. Through which we can identify there is a murmur sound or regurgitation, any sort of sounds, abnormal heart sounds can be found. Then laboratory tests, usually infection means ESR, blood culture, then WBCs, total blood counts. Okay, these things should be done. Then pulse oximetry can be done to assess the oxygen saturation and hemodynamic status. Electrocardiogram to reveal any valvular disorders or any myocardial damages are associated, because this endocarditis may further grow into myocarditis. Okay, so it can cause myocarditis as well. So to rule out such conditions, they will go for further diagnostic tests. Okay, what is the management for this condition then? Usually the best thing is prevention. So prophylactic treatments should be given, various sort of penicillins, amoxicillin, or some clindamycins, azithromycins, clarithromycins should be given in order to prevent any sort of occurrence of infection in surgical procedures. Any surgical procedures, they are planned surgical procedures, means they have to give antibiotic therapy, preventive antibiotic therapy for first 1 week of period. Then they have to do surgical interventions, which prevents most of these type of infections. Okay. pharmacological management, antibiotic therapy is usually given for 2 to 6 weeks. Okay, longer period of antibiotic therapy is required to completely cure the microorganisms from inner part of the fibrosed tissues. Okay, so because the source of infection, though we give antibiotics, it may superficially, it may clean, symptoms may reduce, but bacterial infection, source of infection will remain inside the fibrous tissue. Okay, so deep cleansing is necessary. So they will give antibiotic therapy for longer period of time using penicillin, ceftriaxone, or vancomycin sort of antibiotics. Okay, after doing such surgical interventions, medical interventions, pharmacological therapy, they will go for small amount of surgical corrections as well, because once fibrosis happens, so that is irreversible. We can't simply remove that. So surgical interventions like replacement of valve, valvuloplasty, artificial valves can be implanted in damaged areas. So such surgical intervention should be done to correct any deformity of valve or heart valve closure issues, okay, which are responsible for heart failure or further complications like decreased cardiac output, etc. Okay, so without that such surgical interventions, it is difficult to guess good prognosis, okay, or poor prognosis of the patient. Mitral valve replacement, aortic valve replacement, any valves which are damaged or papillary muscles which are damaged should be corrected through these surgical interventions. So nursing management, of course, depending on all these risk factors and involvements, we should look into the possible outcome we should expect. So depending on that, we have to plan nursing management. Usually, fever management should be done if prior to any sort of surgical interventions. So fever management along with antibiotic therapy. Okay, and antibiotic therapy, fever management. If the patient is hospitalized, then if they are planning for further treatment, because antibiotic therapy continues for longer period of time, you have to educate the patient regarding management of medicine or treatment regime, how when they have to return to the surgical intervention. So to what extent they can plan or delay surgical procedures. Delay surgical procedures. So those things should be properly taught. Then during hospitalization, if they are in acute conditions or the onset is severe and their hemodynamic status is so poor, then oxygen administration, IV infusions, parenteral nutrition, antibiotic therapy should be taken care. So along with that, intake output chart, like whatever basic things we do for heart failure conditions, so all such things should be done in nursing management of this condition as well. Okay. Decreased cardiac output related to altered rhythm, arrhythmias, valvular insufficiency, or contractile deficiency should be taken care, without which it's difficult to save the patient. So if there is no such issues, we can send back the patient to completion of antibiotic therapy. Then when they comes back, again we have to prepare them for surgical interventions, preoperative precautions, then post-operative care. Okay, so such things should be involved in this nursing management. So these are the things which are involved in endocarditis. Okay,